right, so good to know that you are there. The program's still here this morning on ITV on independent television. Now, I told you that we are going to be looking at what seems to be a very big problem now in the vaccination exercise that is going on. And of course, it's almost a global trend too. Talking about the fake vaccination cards that, you know, just peddling around in some countries of the world and also some states too. Well, we also got a report that the Edo State government is not resting, and they're also ensuring that this does not become a problem in Edo State here. Now, yesterday, if you listen to our program, Impact, the program that comes by 3:15 Monday, Tuesday, and on Friday, I was on that show, and we had the opportunity to speak with Mr. Haruna Yusufu, who really talked about, he talked against the COVID-19 fake cards that people may want to take advantage of. That's the situation when people don't want to make themselves available for vaccination. So as we speak, as we also encourage people to know that the best thing you can do is to make yourself available for the vaccination, because a time will come, just like what I said at my introduction, that a time will come that you may have to pay for the vaccination. So now that the government is doing it free, try to take advantage of it so that when that time comes, you may not pay. Now, the fake vaccination cards, it's a big issue in the United States of America. We understand that that seems to be one major business that some persons that won't just keep with the law are doing now. And also, the government there is also not resting on its hours. Well, to discuss this morning, we are so privileged to have Mr. Osamede Ikmomusa, who is a member of the COVID-19 Risk Commitment Committee, Risk Assessment Committee of the COVID-19 in Edo State here. Mr. Osamede, you're welcome to the program.
Thank you very much, and good morning to our viewers at home.
All right, now we also invited Mr. Yusuf Haruna, but because of his busy schedule, he couldn't make it, so Mr. Osamede is here. You're welcome one more time.
Thank you.
Now, we're at it now, talking about the COVID-19, and of course the vaccination. The fake vaccination cards, it's the major issue. Now, what is really going on? Why do you think people are really not making themselves available for the vaccination?
Well, you know, whenever there is a law, people would invariably want to find ways to break that law. In fact, this morning I was at Government House and there was a guy, because of course there's that law, there's that directive that people who have not been vaccinated or who do not possess that card cannot go into Government House or the Secretariat or any other government building. So there was a guy this morning that wanted to, that produced that fake vaccination card. And it was scanned, and it was found out that it was actually fake. That person has been handed over to the police as of this morning, because when you flout a directive, it's a criminal offense, it's fraud. So people would invariably want to look for ways to beat the law, but Edo State government is making it known that those persons who are found wanting, there's a law that would also catch up with them. So we are trying to disabuse the minds of people who want to break that directive, because as it stands, where my right stop is where yours begin. So I shouldn't be found anywhere near you if I have not been vaccinated, because I pose the risk of infecting you. So that is invariably the directive in Edo State, because people are saying, oh, why is vaccination compulsory? The truth is, vaccination is actually not compulsory. What is actually compulsory is the protection of lives. Okay, the Edo State government, led by His Excellency Governor Godwin Obaseki, has prioritized the safety of the lives of Edo State people, because the data and the statistics that is available before us is that COVID-19 is killing. It is killing people on a daily basis, and there is of course that African mentality that what the black man, okay, doesn't know would not kill him. So people are out there trying to pay deaf ears to the COVID-19 message, how to prevent it, just because they want to live true to that saying that what they don't know doesn't kill them. But the Edo State government is putting this message out there to sensitize people that, see, COVID-19 is killing, because they have to first of all know that COVID-19 is real. As we speak, about 50 persons already have died from this third wave of COVID-19 with this Delta variant that we've been hearing about in the news. So it is here. It is killing people. So only those persons who have been vaccinated can say that they are protected from even the Delta variant. So,
Okay.
so it is killing people on a daily basis, and when it kills people, what people say, oh, this person died of after a brief illness. But the truth is, what is actually the brief illness? They would never tell you. The families of the bereaved will not tell you what killed this person, except you go for a post-mortem. And from the records, the autopsy that have been done have showed that this person actually died from COVID-19 complications, respiratory complications. So what that means is that it's either we protect ourselves.
Is it only when somebody has respiratory complications that the
Yes.
person has COVID? Because before the advent of COVID,
Yes.
people have always had respiratory complications,
yes,
asthma and all that. So
Yes,
how
but
come
it is-
anything that is somewhat like a respiratory complications now, people target COVID?
Yes, because people that have asthma, people that have any of all those respiratory conditions, it's only when it has become dire, okay, when it has reached near the end stage, that those persons die. But COVID-19 actually makes all of those processes even faster. Okay, so when the person have any respiratory condition or the person has any other comorbidity, like hypertension or diabetes, what COVID-19 does is that it enables those disease states to progress even faster. So that person die even faster from many of those comorbidities. So that is the truth about COVID-19. It deteriorates the health of people who have COVID, who have any other comorbidities. So, of course, before we say a person died from COVID-19 comorbidities, we have to actually do a test, because the records that we are actually putting out there are not those persons who died, let's say, in so village or healthcare center. They are actually those persons who we are managing, okay, in the health facilities that we've already tested, and we found out that these persons have COVID-19. So when they finally die, we can now authoritatively say that those persons died from COVID-19. So it's not just the records that are out there. It's not just those persons who are dying in those states. Okay, there are persons who we are managing in the health facilities who we've already confirmed that those persons have COVID-19. So when they die, we can say for certain that those persons died from COVID-19.
All right, viewers out there, the program is still this morning on ITV, and we're looking at the COVID-19 vaccination fake vaccine card sale. That's our focal point this morning. Now, Mr. Ostamede, you talked about that your committee, the enforcement team, caught a certain guy this morning. You know, at Government House, as he was trying to beat the checks.
Yes, he was trying to beat the law.
Yes. Yeah. But don't you think that, because the way it seems now, it appears that some officials, you know, that are supposed to even carry out this vaccination may just be compromising the whole process. In other words, they can give you the card. The card is genuine, but you did not actually take the COVID-19 vaccine. So if that is the situation, if we have a situation whereby some officials, some health officials collude with would-be citizens and they compromise the vaccination, how do we have that?
Well, there's a reason why the medical profession is often called a noble profession. It is because they are not expected to lie. They are not expected to be found in dishonest ways. Okay, there's a physician's oath or even the Hippocratic oath that these health workers have to take. Okay, what it means is that you would never lie. You would never be caught lying. Okay, because we are dealing with health. Okay, the Hippocratic oath actually says that even if you are not going to do good, then you shouldn't do harm to people.
Are you saying that we don't have corrupt health workers? In the US, we understand that some doctors...
Of course, there will always be bad eggs amongst the
health workers are buying the fake COVID-19 cards in the US.
But in Edo states, that is not the case. Okay, because these physicians, these health workers, have been trained, okay, to actually give this vaccine, and then after which the card is given to such person. And of course, you can't even be given, the card cannot be authentic without the person actually taking the vaccine, because of course, the enforcers even at those various vaccination points. We have more than 20 vaccination points in Edo State, and if time permits, I would like to even reel them out, because people are saying that they don't know where to get these vaccines. Okay, but the data is here, and if time permits, we should be able to reel out it to these people, because it's just a stone throw from where they actually live. So you cannot be unvaccinated and then have a card. If that is the case, then such persons would, of course, be handed over to the law enforcement agents, the security agents for prosecution, because the cards actually are personalized. They have that bio data. Okay, it has the name of the person who have actually been vaccinated. It has the age. It has the location where that person was actually vaccinated. Where that person was actually vaccinated, and then that data can be corroborated with the device that is used to scan the barcode of each vaccination card.
Now, apart from you having a device to scan whether the card is genuine or not, are there other special features that may, looking at a card, you just know that, look, this is fake, just like your Naira bill. When you see a fake Naira bill, there are things you can use to ascertain. There are ways you can ascertain that it is fake. Are there ways you can ascertain that, look, this COVID-19 card you're giving me, it's fake? Are there ways we can know?
Yes, even like the currency, the Naira notes, okay, only through a luminous agent can even a Naira note be ascertained. That's what they use in the bank, okay, they put it under that light, okay, to find out if that currency is actually genuine, because they are actually near fakes, they are deep fakes, okay, of even Naira notes, okay, or even the dollar bills, okay. So it's only when that note is put in that luminous agent, that light, special light, okay, device, that note can actually be verified to be true. It's the same with the vaccination card, okay. When the code is scanned, to be able to tell, it gives the person enforcing the data of that particular person who claims to be bearing it. So if that person is bearing a card that was assigned to, let's say, Collins, and that person's ID is actually saying that person is say Evans, then that person will be taken to the security agent. So there are features, stopgap measures to be able to catch those persons who are actually presenting fake. But the truth is this: why will anyone even want to go ahead and say, oh, they want to present a fake card when the vaccination is actually free?
Yeah, but you can ask that question just the way some people will ask, well, how come Edo State government is the only government that is enforcing
as we speak,
the vaccination?
As we speak, Ondo State has actually given a date, I'm not so sure of the date, when government workers are going to be required, okay, to present their vaccination cards, otherwise they'll be sent back home. As we speak, even the Joe Biden administration has actually enforced that all federal government workers in the U.S. have been told to get vaccinated. Otherwise,
but what do you think? What do you think is the special attention in Edo State? I mean, the federal government is not enforcing it yet. If you go to State House, in Abuja,
okay.
I don't think if there are strict measures as such that, look, if you don't present your COVID-19 card, you may not be allowed into the state, into Aso Rock, so to say. Even yesterday, I was watching a plenary session at the House of Assembly, the Senate to be precise, and of course I saw people visiting for the first time, you know, taking a look and going what is going on. The question is, if the federal government is not enforcing it yet, how come in Edo State there seems to be this hard measure, you know, for people to take the vaccine? What is going on?
Well, that might be due to the advisement that is currently before the president. Just some few days back, the Federal Ministry of Health actually puts out a notice that they are going to begin vaccination in churches. Okay, when that will begin or when that will commence has actually not been stated, but they said they are going to begin in churches, and persons who are coming to worship would be asked to get vaccinated, okay, at the door, at the church premises. So what that means is that they're actually working towards that vaccination, okay, being required of all government workers. It's only going to take time. But in those states, we have a governor that is informed, okay, a governor that is a technocrat, so to speak. So he works with the science, he works with those persons who are actually trained in epidemiology. So those persons are those who actually produce these advisements, so to speak, that the government should proceed with this directive. Because when something is killing, the governor cannot just sit and stand akimbo and say, oh, let people continue to die irrespective of his actions. Okay, he cannot just sit
Yeah,
back and say, "Oh, let people die." So he has to take
the
decisions
death rate
to
is
protect the people.
still, the death rate in Edo State is still not as alarming as what is going on in Lagos State, and yet Lagos State may not be hard the way the state government is hard on vaccination here. That's the question.
Well, those subnational, they are actually called subnational government. The states are subnational government. They are sovereign in their own right. So whatever decisions they want to take might be due to their own peculiarities. But in those states, we've seen that the facilities, of course, we have facilities to manage these persons, but we don't just want to let our people continue to die when they can actually be protected from this disease. The governor himself stated it last year that he himself was actually affected with COVID-19, so he knows actually how dire it is for someone to say, oh, he has been infected with COVID-19. So he doesn't even wish that on his enemies, and that is why the people who he has actually sworn to protect, he doesn't want that COVID-19 to actually infect them. So he's actually coming from a place of compassion, a place of sympathy or empathy, that this person, he doesn't want them to actually fall down or come down with COVID-19. So it is the best measure, because when we were born, every one of us was vaccinated. As far as you were born, say, in the hospital, even when you go to school, even without even your parent knowing when you were young, you were vaccinated in school. Okay, you were vaccinated against polio, you were vaccinated in church against diphtheria and all those other diseases. Okay, even without your parents knowing, because it has come to the fore that these diseases actually kill people. So I really actually don't know why people are choosing to be very adamant, okay, with this COVID-19 vaccination. Maybe because of the conspiracy theory that is out there. But Edo State government has actually moved a step further, because we understand that people would almost want to believe everything their religious leaders or traditional rulers say. Okay, so we've worked with these people. We've worked with the CAN chairman in Edo State, Bishop Oyenedu Kure. We've also worked with the chief imam of Edo State, Alhaji Inabulele Abdul Fatai. So he has actually taken his vaccine. He has taken his vaccine. The CAN chairman has taken his vaccine, and they have told people out there that, see, take this vaccine. It is safe, effective, and it is free. So we just want to continue to put this message out there, because we want to sensitize people. Because of course, people say, oh, what they don't know won't kill them. But we want them to know, okay, because COVID-19 is killing people.
Okay,
so,
now let's talk about
yes,
the enforcement of the vaccination one more time. Most especially as it relates to the rural settings, because
yes,
some people say that it seems that the enforcement is only in urban centers. Take, for example, the man in the village that also needs to access a public building. Take, for example, the man in Usain. He needs to go to the secretariat at Igobazoa, that's Ovia Southwest now.
yes,
And there's no internet facility there, because if I come with a card, for you as a member of the enforcement team, for you to allow me entrance into that public facility, you need to scan my card. Now, in this place, there's no internet. I understand the gadgets that you use to scan, it has some internet and connectivity.
yes.
But in this case now, there's no internet in this place. It's a rural setting. And of course, I give you my card. So would you just face a look at the card and say, okay, you can come in? Because now that we have fake cards, peddling around.
Okay, for those in the rural setting, of course, I believe even in some of those areas, they have internet connections.
Yeah,
okay,
but there are some places that you may not have. Yeah.
Yes, it might be poor. Okay, it might be poor, but there is a level of internet connectivity, and it doesn't actually require 4G or 5G internet connection. As low as even 3G or even 2G can scan those barcodes. So even those rural settings are captured in that way. And of course, ITV is a digital platform. Okay, your signals reaches even those hinterlands. So they've already seen. They are probably watching this program right now, and they are being sensitized. Okay,
is your team enforcing?
Yes.
Is your team enforcing it over there too?
Well, for now, even in those areas, enforcement hasn't gotten to that level. Only two, the major areas for now is the Edo State Government House and the Secretariat that is at Saple Road. okay, and any of all those MDAs that are scattered around the metropolis. But it's definitely going to go into those hinterlands with time. But sensitization, I just want to put the sensitization out there, okay, first, before we begin enforcement in those rural areas. And as we speak, the uptake of these vaccines have increased since this directive was put in place. It has increased. Okay, you go to the vaccination place. If you go to UBTH, for example, which is very close to this place, you see that you see hundreds of people.
Yeah, but we are also not seeing we're also not seeing a reduction of deaths, at least to commensurate
yes,
with. Because even the state government says that death is on the high side as a result of COVID-19.
Yes.
So if you are saying that the vaccination, that people are making themselves available for the vaccination, how come we still have death rates keep on getting high?
Yes, as we speak, those states last week, we also got another tranche of the vaccine, about 50,000 of the Moderna vaccine. And like I said in previous programs, you have to take those 2 shots, okay, before you can say you have been completely vaccinated. Edo State government is working to get the kind of vaccine that will require just 1 shot, for example, like the Pfizer. Okay, the Pfizer vaccine is just 1 shot.
I know.
Okay. But the Moderna and the AstraZeneca, you have to take 2 shots spaced between 6 weeks.
Yeah.
So when we get to that level where we are able to get the Pfizer vaccine, okay, we will then be able to say, okay, there will be quick reduction in the number of people who are dying from COVID-19. And those 2 governments, okay, there's that fear. Just want to allay that fear that, oh, the vaccine will get exhausted. It won't get exhausted. These vaccines have been produced in millions, even billions, okay, in terms of quantity. So there will always be availability of vaccines. We've received Moderna again, and today the second dose of that Moderna vaccination will actually take place. Okay, so those persons who have taken their Moderna vaccine in time past, okay, they can go to any of the PHCs, any of the tertiary institutions, health institutions in the state, and go take their second vaccination. Okay, so for the AstraZeneca, it's still 2 shots. For the Moderna, it's still 2 shots. But as time progresses, we might be able to get the Pfizer, which is 1 shot. So once a person has taken his 1 shot, that person will be protected from COVID-19. So we just want to say that instead of allowing, for example, for myself, I got vaccinated not because I posed a risk of, even before this directive was put in place, because I have elderly ones, okay, my parents, okay. I actually do not want to put them at risk. Yesterday, a 94-year-old elderly man actually died, himself, and also a 91-year-old female. So those persons are actually the ones who are actually coming down with fatality. Yeah, okay?
but
so
we've always
the young
had,
ones should protect their parents, should protect their elderly ones. Just be your brother's keeper. When you are protected, then you would not be able to infect your elderly ones, your parents who are stay with you, so to speak. So we are just putting the message out there to just be your brother's keeper, because COVID-19 doesn't know gender, it doesn't know social status, it doesn't know your ranking in society. Okay, so just be your brother's keeper.
All
take
right,
this
so
vaccine.
yeah,
Yes.
beautiful. So what we are saying is that the importance of the vaccination cannot be overemphasized. And of course, we understand that we have different places that the vaccines can be taken. For example, we understand that at the NPHDA, that's the National Primary Healthcare Development Authority centers, across other states. The vaccines are there, and of course at public places too. So we in the media, we are not denying the fact that there is coronavirus. We know, we understand, and of course we accept the fact that there is COVID-19. And we also accept the fact that vaccination is one way that you can actually fight the COVID-19. So you must make efforts to join hands with government, just the way we at Independent Television and Radio are also joining hands with government to ensure that people get their vaccines. Now, for those peddling fake cards around, you are not helping the situation at all. You are not helping the situation because you'll be caught. And once you are caught, it's going to be a very serious thing against you, I bet you. The government will catch you. So in case if maybe you flew in from outside the country and you have a fake COVID-19 card, You cannot beat the system. You'll be definitely be caught. So be warned. All right, Osamide, thank you so much for joining us on the program today. Now we take our cameras back now to the studios in Abuja.